Hi, I'm Dr. Scarlett Spain, the host of the NP Professor podcast. I'm super excited to welcome my good friend and colleague, Sara Doyon, to the show. So welcome to the show, Sara.
Hey, Scarlett, thanks for having me.
Oh, we're so excited you're here. So I'm going to start today by introducing our guest a little bit more. Sara and I have known each other, met probably about 10 years ago now. So we worked in an occupational medicine clinic for a short time. She was actually one of my students, one of my favorite students of all time. And Sara now works in an integrative medicine clinic in Florida. So I wanted her to join us today first because she's awesome. And also I want to learn a little bit more about integrative and alternative medicine. I don't want to say it's a buzz term. I don't mean that, but I know I'm teaching a farm course right now, and this has come up and something in regards to what I need to teach. I honestly don't know a lot about it, so I wanted to bring in someone who's actually practicing in that role to kind of talk to us about it. So our objectives for the episode today is to get to know you a bit better, Sara, and also your practice. So with that, Sara, can you please give our listeners a brief rundown of who you are and your journey as an NP?
Okay. Well, first off, thank you so much for the kind words, Scarlett. I hope I live up to that. You were by far my favorite professor, and I'm glad that it's
Oh,
turned into a friendship. But as Scarlett mentioned, we met nearly 10 years ago as I was finishing up my MSN at Purdue to graduate as a family nurse practitioner. Since then, fortunately, we've been colleagues, friends, and I would say that she's my professional mentor, although I'll probably never live up to what she's accomplished.
that's so sweet, but untrue, but sweet. Thank you.
No, very true. But I will quickly touch base on my background because I believe that the foundations we have as nurses are so important of like who you become as an advanced provider. So as you've all probably realized, those foundational experiences, they impact your nursing journey and your nursing style so much. So when I graduated with my RN, and this was, gosh, feels like a very long time ago, or maybe a couple, I don't know, a long time ago. I was very fortunate to be faced with several job opportunities. I was young, I really had nothing to lose, and I had the mindset of everything's going to be scary, so just jump into the most scary setting that you can because you won't even know the difference at that point, right? So I worked as an ER nurse for about 10 years. Um, they were all very high acuity emergency departments, and they were all in relatively lower socioeconomic settings. So you saw a lot of health disparities, things like that. Um, I was also lucky to dabble in like OR. I worked for a mobile anesthesia company in Chicago for a long time, for a little bit. But it was my ER nursing experience that drove my decision to achieve my MSN. Um, it was kind of the revolving door of the ER that drove that decision, right? You want to kind of figure out the underlying problem. So many patients didn't
Mhm.
have to be return patients all the time.
Yes.
Um, so it drove me to an interest in like improved root cause treatment, whether it's chronic pain, diabetes, hypertension, that ultimately cascaded into that need for emergent management, but it, in my opinion, could have been avoided. I had a passion for helping marginalized populations with health disparities achieve high quality care, achieve root cause oriented care. And the ER, although much of it was quite emotional, it allowed me to really hear the struggles that patients were experiencing, not only physically, but mentally, financially, personally, professionally, environmentally. And if you're
Mhm.
familiar with a functional medicine practice, um, those are a lot of the kind of aspects that fall into it, which I love. But I realized that without addressing each of those aspects, the ER might always be a revolving door to an extent for a lot of these patients. So, as Scarlett alluded to, I graduated with my master's in, I think it was 2018. Um, After passing boards, flexibility was important to me just because of where I was at with my personal life. I worked for a small private practice as a family nurse practitioner in Michigan. Well, crazy now, but I was also simultaneously commuting to work with Scarlett.
One.
So complementary medicine is defined as a non-mainstream approach being used together with conventional medicine. So ultimately, in my mind, it's very similar to integrative
Okay,
medicine. And I think there are some like shades of gray from area to area,
right,
honestly,
right.
but they all have the same goal. They all have the same goal of treating not just the body, but the mind, the spirit, considering the environment, using multiple modalities, not looking at things as a one-sided approach.
Yes, yes. Is it safe to say, or is this a correct assumption then? So what you're doing, you're taking multiple different approaches to try to heal and provide health and wellness in a client or a patient of yours. So it could be Western techniques, alternative, complementary, and that is kind of what the integrative medicine approach is. Is that kind of,
Yes, I think that's fair. And I think each diagnosis that we treat, we may integrate one more than the other. SIRS, for example, I mean, we definitely, if their pain or if their inflammation is causing them pain, we absolutely will refer them to acupuncture. We'll absolutely encourage yoga. We'll absolutely get them to physical therapy or chiropractics.
yep,
But I would say that as we treat SIRS, it's a little bit more Western focused. We use certain pharmaceuticals pretty regularly. Very few of them, fortunately. In my normal practice prior to discovering this, my goal was to prescribe like as little as possible and to avoid polypharmacy and all of that, which is hard to do in a 10-minute office visit for a traditional setting. And that's something that I'm really passionate about with this, is we try to get them on the minimum, because otherwise, how do you know what's a side effect versus an actual problem?
for sure.
Um, and then we really heavily utilize diet as a means of healing and supplements to support all of those biochemical reactions, deficiencies, things like that.
Mm-hmm.
Does that answer that question for you?
It does. You mentioned earlier the term nutraceuticals, and I thought that was such a cool term. So I'm assuming that it's just nutrition-based wellness through foods and supplements, I would assume. And that seems like such an important thing. I will say too, and I know we've probably already talked about this, but as I'm getting older, I have been trying to incorporate more vitamins and minerals into my system, just, thinking that menopause may be looming at some point since I'm in my 40s, you know what I mean? Just to make myself feel better. And maybe it's a placebo effect. I don't know, but I do feel better after I started incorporating a bunch of vitamins into my diet. So
I would say the exact same thing, actually. I have a seafood allergy, a shellfish allergy, have forever. And at one point, I was reading up on brain fog, and it talked about how you may be deficient in omega-3s. So I ordered a vegan omega-3. And that was, I mean, that was years ago, but that was the first time that my eyes were really open to like, oh my goodness, I took
yeah,
this and I feel more clear.
yes,
And that's actually a supplement. That's like one of the mainstays that we use. But to me, I was like, okay, there's something to this. I'm not crazy. It's not in
yes,
my head. Your
yeah,
body is missing something and it needs it.
yeah,
So it kind of ties back into my wish that our education just included a little bit more of that. I know that they
yeah,
have a lot to pack into those couple of years that we're in
yeah.
school, and it is what it is. But it's a really interesting thing to gain continuing education on. So
Yeah, for sure. That kind of leads us well into the next question, I think. Um, can you talk to me about how you incorporate evidence-based practice? And I'm assuming it's probably the same way that, you did it in Ahmed, but just talk to me a little bit more about what that looks like in this role.
sure. So evidence-based practice in this role, I think one of the important things to touch base on is how new this diagnosis really is of SIRS, CIRS. Um, it was, like I mentioned, I think it was essentially discovered in 2000. It's gaining a lot of traction. I was reading an article actually, and Jonathan Tabes from Chicago Blackhawks was diagnosed and treated for SIRS after he had COVID, I believe. He came down with it, which is quite common.
Yeah,
So it's definitely gaining traction. And I think when those big names come out and say, hey, this is what I found out that I actually have, and it's really literally taken him off the ice. And I don't know what his treatment is or anything about it beyond what
Right.
was in that article.
Right.
But the point being it's new and it's gaining traction. So how is the evidence-based approach used? I think similar to, like you say, a lot of other specialties, modalities. We're utilizing labs that are indicative of like every biochemical reaction we're looking at. They're very indicative of inflammation. Some are widely used in primary care settings, some are not. We're utilizing certain genetic labs, like one is called a HLA-DR, and it tests for human leukocyte antigen, and it identifies a genetic susceptibility to SIRS. That's kind of the gold standard. Depending on how that genotype comes back, it correlates with what you may or may not be susceptible to with chronic inflammatory response syndrome. Other labs that we monitor include like MSH, which is melanocyte stimulating hormone, TGF beta 1, which is transforming growth factor. That one is really important with cell growth, division, differentiation, motility. A lot of what happens with this is mitochondrial dysfunction. So we're looking at like literally on a cellular basis, how is the person reacting, improving, or declining? So I could get into, I mean, it's more labs than I've ever had to know in my life, honestly.
Sure.
But I could get more into that. I don't want to get stuck in the weeds. Another test that we use is called a neuroquant. And that is a form of MRI that basically tests for like specific forms of brain atrophy that our patients will show progress as we remove them from exposure to mold and begin a treatment protocol. So those things help us to know that the practice is working, and the protocols are working. And then on top of that, when you just have patients come back for literally night and day differences, it confirms everything for you. So does that answer your question?
It does. Thank you so much. So for our listeners, I wanted to bring Sara on again, and I apologize. I'm sitting outside in Savannah and there's kids going down the pool. We have sun now. This is good. So if you hear noise, I think somebody is cleaning or something down there too. Anyways, for our listeners, I wanted to bring Sara on just because I really wanted you to see that there's so many specialties in the role of the NP, and to really, knowing Sara, and I don't want to speak for you, but it sounds like she's found her passion. And even when she worked with me in Ahmed, like she's always been wellness. I would be eating like a nasty 3-pound burrito and she would be eating a salad, and it was fine. But I just want to present this, and there's even if this doesn't necessarily interest you, there's other things that we have to think about in treatment of our patients. If we are too focused on Western medicine, I truly believe there's a whole other side of medicine that we could be effectively treating our patients. And sometimes that Western medicine just ain't gonna cut it. You know what I mean? So I want people to really, just because again, when I was in MP school, I feel like this wasn't really talked about. These other integrative medicine, and there is more of a push, which I'm happy to see, because it is definitely a valid treatment for conditions. So I just want students and our listeners to know that you need to recognize that there is environmental factors. And this is another thing that I obviously look at with public health, right? But you talk about the environmental factors for one of the main conditions you treat, and there's so many different things that people can be exposed to. So to be a well-rounded clinician, I think you really do have to, with your assessment and your history, find out different exposures, and then, think about the best way to treat that. And that's kind of, Sara, it's kind of our occupational medicine base too, right? Because that was something that for us was so important. What were you exposed to? And then when we were doing his surveillance exams, what were you exposed to? Asbestos, what chemical did you come into contact with? And we get the MSDS. So really, when you
Yeah,
think about it, it's, pretty similar to
absolutely.
how you started your career. Um,
It very much is. And that's something that crossed my mind too. And certain tests that I'd never heard of before, actually, that we use to help diagnose this are like very much recognized by OSHA and things like that in
yes,
terms of spinning back
yes,
to that evidence-based practice. I would have never known about them, but
yeah,
OSHA recognizes them, the military recognizes them for exposures, all sorts of stuff.
yep, yep,
So it was a really great foundation for this and a great lead up because that setting in occupational health, I mean, people are exposed to so much that
yeah.
that's not taken into
Yes.
consideration. It's really hard to heal them.
Yes. And I'm not saying that internal medicine or other people don't do a good job on gathering environmental exposures, but I do think, with us coming from occupational med, that is very much something that we must do in regards to injuries. And then again, with surveillance exams. So it's really important that we know where the employee was working. Even when we're looking at saving hearing, what kind of noise are they exposed to? Is it
Mhm.
repetitive? So that's a key part of our practice. But um,
Absolutely.
yeah, Sarah, you gave me or you gave us so much great information today. Is there anything you would like to say in closing or anything, I don't know, that I may have forgotten to ask or that you feel is important?
Oh gosh, I think you would know better than me on that point. But please let me know if you want me to expand on anything. I think the best advice I can give anyone listening to this is kind of think about what you're passionate about. And even if you just love traditional medicine, you just want to go into a normal, like a conventional medicine setting, whatever that is, specialized or non-specialized, primary care, doesn't matter. Um, my recommendation is just think of like one area of life you're passionate about and try to integrate integrative treatment. I didn't mean to do that
Yeah.
within that.
Yeah.
And that can go a long way. I know Scarlett in occupational health, she did the Freedom from Smoking campaign. And that trickled down to me. I brought that to a different nonprofit up in Michigan, was able to implement freedom from smoking. When I moved, the medical assistant took that over because you didn't have to be a healthcare professional to do that.
Good. Good.
So yeah, the point of this is just if you can bring in just one holistic means of managing something,
Yep.
it can really go a long way. And you don't know who else you're going to influence. It doesn't mean you have to give up another way of practicing that you're passionate about. But I think it's just really kind of cool and fun to see what a difference you can make by finding something specific um, that you can integrate in a kind of more holistic way.
Yes, that's a really good point, Sarah. And I will say from my experience, and you probably would agree, patients really do love things that I don't want to say outside the box. I don't think that that's the right term, but patients really love when their providers are engaged or providing other means for them to, be headed towards wellness. They really, really enjoy that. Just because I think people, especially now, people really are identifying that not everything needs to be treated with a pill. And, what's the basis of pharmacology? Every time we have somebody take a pill or whatever, there's going to be side effects, and it's not a magic
Mhm.
bullet that's just going to do that one specific thing in the body. So, yeah, there's different ways of looking at things and different ways that we can team with our patients as partners to provide them wellness.
Yep. And one other point kind of leading off of that is in more traditional practices, because I would not expect that everyone's going to all of a sudden magically be in functional medicine. I don't think that would
Right.
be the best thing for healthcare in general. We need everyone to do everything.
Yep.
But one of the other things that was interesting as I was doing some early continuing education after achieving my MSN um, was CE credits on medical weight loss within a primary care setting.
Mm-hmm.
And the interesting thing there was it taught me the lesson that if you know your CPT codes, which I work for nonprofits because I don't want to deal with insurance, but
Right.
if you know your CPT codes, you can do a lot as a provider and then still gain reimbursement for your practice. So
Yeah.
at a certain primary care up north, I implemented like a weight loss program, and I was able to code it so that we were still paid, patients were still happy,
Very cool.
and it helped address, comorbidities like hypertension, diabetes, high cholesterol more holistically.
Arthritis. Yeah.
And I got to be a weight loss coach and get paid for it, which
Oh,
was a
that's
fun
cool.
little, it was a fun little change for those office visits.
Yeah.
So I think that's just another tidbit of advice is just when you're working with insurance, as much as we don't want to think about it, sometimes there's some cool things you can do that you may not be aware of.
Yes. Well, and that's a good point too. And I don't even think we accurately or, caught a good, big picture of that, but Sarah's had a really cool career and has ended up in like really cool positions, throughout her NP career. So that's been really fun to watch you just do these different things. Just, and I think it is from, as you mentioned earlier, your passion for underserved and, certain populations. So that's been really fun for me to watch you be in these really awesome positions. So
Well, thank you, Scarlett. You are so kind. You flatter me probably more than I deserve.
no,
Um,
no,
but
no.
um, but I hope I was able to answer some of your questions today.
Yeah,
There's a lot to cover in a short amount of time.
yeah,
And but I hope it just, like you said, plant some seeds.
yes, yes. Well, thank you so much. It's been awesome chatting with you. Thanks so much for giving our listeners information on you and integrative medicine. So many congrats on the babies. I cannot wait to
Thank
actually
you.
meet them in person, hopefully sooner rather than later.
Oh,
Uh,
any day now.
so, and people probably can't even tell Sarah's like really close to delivering. Um, so he looks great. But yeah, thank you so much for being here today. And for my listeners, I will see you on the next episode. So thank you. Bye.
Thanks, Scarlett. Thank you, everyone else, for listening. Bye.